When can I shower after surgery? That is one of the most common questions that I get in clinic. Being able to take a shower after surgery, it just seems to reset the clock, make you feel normal again after this big ordeal that you've been through. Every surgeon has different protocols, so it's important to discuss with your surgeon. But for me, I let my patients shower the day after surgery. I use a glue tape mixture on the incisions that makes the incisions essentially watertight. But once again, just showering, letting soap and water run over the incisions, not scrubbing the incisions, patting dry with a clean towel, and putting on whatever post-operative dressings were recommended. There are only real two exceptions to this in my practice. The first is if we do a free nipple graft as part of your breast reconstruction. If you do a free nipple graft, which means removing the nipple in the areola and putting it back on at the end of surgery, there's a big bulky bolster dressing on top that I don't want you to get wet until I remove it a week later. The second exception would be if we use a wound vac on your breast after surgery. Sometimes I do this in a woman who has a history of radiation if I'm concerned about the incision healing well. We did another post about what a wound vac is, so you can refer to that. Now, there was this antiquated old idea that if you have drains, you shouldn't shower until your drains are out. I personally don't practice that, and I do not think that there is evidence to support that, but some surgeons still do that. If you do shower with drains, though, please be very careful. Secure them on a lanyard, a pair of beads that you can safety pin them to, because you don't want them just swinging in the breeze. They can really irritate the skin. If you had surgery, how soon were you able to shower after surgery? Let me know below.